Welcome to this presentation of Strengthening Your Child's Immune System. My name is Keith Wasson. Let's get started. Every parent wants a healthy child, and good health depends on a strong and properly functioning immune system. But there's a growing concern about the health of our children. In recent years, we've seen dramatic increases in immune-related health disorders, including asthma, allergies, autoimmune conditions, and food sensitivities, just to name a few. This has prompted people to begin doing reading and research on their own in order to find ways to improve the health of their families. If you go into any major bookstore and go over to the health section, you will see a large number of books devoted to the subject of boosting the immune system. A recent Google search of immune system boost yielded over 8 million hits. Psychoneuroimmunology is the study of the interaction between psychological processes and the nervous and immune systems of the human body. The main interests of psychoneuroimmunology are the complex interactions between the nervous and immune systems and the relationship between mental processes and health. Psychoneuroimmunology studies, among other things, the physiological functioning of the neuroimmune system in health and disease. The field of immunology research is fairly new. Not much was known about the workings of the immune system prior to the invention and widespread use of the electron microscope, which occurred in the 1930s. Even then, immunology did not receive a great deal of attention from the research community, and even then there was many misconceptions about how the immune system functioned. For example, it was commonly thought that the immune system was independent of the control of the central nervous system. This changed in the middle 1980s when AIDS and HIV research prompted researchers to begin investigating the immune system in depth as a functional unit rather than just from a disease pathology standpoint. The 1990s were dubbed the decade of the brain because the research community renewed its interest in studying the brain and the nervous system. And there were many amazing discoveries, with two of the most significant being the importance of the nervous system in health maintenance and the complex interaction between the nervous system and the immune system. In the landmark book, The Healing Brain, Dr. Ornstein and Dr. Sobel wrote, "To understand health is to understand the central role of the brain and nervous system in maintaining the resistance of the body. Health maintenance is the primary function of the brain, not educational thoughts, language, poetry, and other functions usually associated with the brain." The research community never publicly admitted they'd been incorrect about the nervous system-immune system connection, but their writings certainly indicated a new direction in the understanding of it. The Lancet wrote, "The focus of science has shifted from separate entities of the immune system to an interactive immunology model. In the neural immune concept, the brain has specific two pathways to the immune system." By the mid to late 1990s, every anatomy and physiology textbook in the world confirmed that the central nervous system was in complete control of the immune system. Armed with this new data on the immune system, many magazines and research periodicals began writing about the healthcare paradigm shift that would soon take place. Newsweek wrote, "Pressed by patience and advancing technology, healthcare will soon change its focus from treatment to enhancement, from repair to improvement, from diminished sickness to increased performance. The transformation has already begun. Accompanying this will be an increased emphasis on psychoimmunology, the science that deals with the brain's role in helping the immune system to fight disease, which will become a vitally important clinical field, perhaps the most important field in the 21st century." The major organs of the immune system include bone marrow, thymus, the spleen, and the lymph nodes. The job of the immune system is to protect and defend the body against infection from disease-producing microorganisms, such as viruses, bacteria, fungi, and parasites that live in our environment. Dr. Robert Adair performed the key experiments to prove the brain-nervous system-immune system connection. And the following summarizes just the essential evidence of the physical connection between the brain, the nervous system, and the immune system. Number one, nerve endings are found in the tissues of the immune system. The central nervous system is linked to both the bone marrow and thymus, where immune system cells are produced and developed, and to the spleen and lymph nodes, where those cells are stored. Number two, changes in the central nervous system alter immune responses, and triggering an immune response alters central nervous system activity. Researchers have found that inducing an immune response causes nerve cells in the hypothalamus, located in the brain, to become more active, and the brain cell activity peaks at precisely the same time that levels of antibodies are at their highest. The brain monitors immunological changes very closely. And number three, lymphocytes, those are the T cells and the B cells, are chemically responsive to hormones and neurotransmitters. The immune system cells have tiny receptor molecular structures on their surfaces that allow them to receive information from the nervous system and other parts of the immune system. It is the nervous system that controls the entire growth and development of the immune system. A baby's immune system is immature at birth. Unfortunately, a newborn carries passive immunity from the mother for the first several months of life. Breastfeeding provides the infant with the antibodies and immune-enhancing factors that develop the immunity. A baby's lymphocytes are not yet capable of producing all of the antibodies necessary to fight disease, and a baby acquires this over the first year of life. Human breast milk is biologically specific for human babies. And what this means is that each species of a mammal makes milk that is uniquely suited for its young. Each drop of human breast milk is alive with millions of tiny white blood cells and immunoglobulins, that are infection-fighting proteins, that circulate throughout the baby's body, ingesting and destroying harmful bacteria, kind of like miniature Pac-Man. As the baby begins to lift its head, it begins developing the very important spinal curves, curves which provide support and protection to the nervous system. Kids begin to crawl at around 6 months, and this is the same time that their immune system begins rapidly developing. The cross-crawl motion causes increased nerve firing into the major organs of the immune system, causing rapid development. As the child is exposed to microorganisms, the lymphocytes start to make antibodies and memory cells, so when the baby comes in contact with those microorganisms again, their immune system will mount an immune response much more quickly. As babies crawl, they begin putting things into their mouth. And this is a natural way of gradually exposing their immune system to tiny antigens, which the immune system must attack and destroy. This is a process which strengthens and protects the immune system. One of the most important things that we've learned from recent immune system research is that the immune system develops in combat. The childhood colds, fevers, infections are the exact method that the immune system uses to strengthen immunity. Healing Arts Press writes, through the process of developing and then conquering infection, the child gets rid of acquired toxins and poisons from the body and also gets a generous boost to the immune system. Whenever the immune system deals successfully with an infection, it emerges from the experience stronger and better able to confront similar threats in the future. Our immune system develops in combat. If at the first sign of infection you always jump in with antibiotics, you do not give the immune system a chance to grow stronger. Symptoms represent the body's best efforts to heal itself. By treating symptoms, you're suppressing the body's natural response and inhibiting the healing process. Instead of treating symptoms, doctors should stimulate the body's defenses to allow for completion of the healing process. A properly functioning nervous system should be the first priority in strengthening the immune system, since it is the nervous system which controls all of our bodily functions. The nervous system works by sending and receiving nerve messages or nerve impulses to all parts of the body. The nervous system is protected by the spine, consisting of 24 movable vertebrae. When the spine is in its proper position, it protects the nerve pathways. But when these vertebrae become misaligned, interference to the nerve impulse occurs, which reduces the overall function of the nervous system and of that particular organ to which it's assigned. These spinal misalignments are known as vertebral subluxations. Nerve dysfunction is stressful to the visceral nerve and other body tissues, and the lowered tissue resistance modifies the immune response and lessens the overall capability of the immune system. The birth process, even under routine conditions, is frequently the first cause of spinal stress and spinal subluxations. After the head of the child appears, the doctor grabs the baby's head and twists it around in a figure 8 motion, lifting it up to receive the lower shoulder and then down to receive the opposite shoulder. This creates significant stress on the delicate spine of the newborn baby. Spinal cord and brainstem traumas often occur during the process of birth, but frequently escape diagnosis. Infants often experience lasting neurological defects. Spinal trauma at birth is essentially attributed to longitudinal traction, especially when this force is combined with flexion and torsion of the spinal axis during delivery. The national cesarean section rate is increasing steadily, and now 1 mother in 3 currently gives birth by C-section. It might seem that birth by C-section would be the easiest and least traumatic way to be born, since the infant doesn't have to hazard the rigors of a long labor or a constricting birth canal. Unfortunately, we have found that trauma to the newborn delivered section is different, but no less traumatic than the trauma that occurs in a vaginal delivery. During the first 2 years of life, an infant often falls while learning to walk, or can fall while tumbling off a bed or other piece of furniture. Even the seemingly innocent act of playfully tossing babies up in the air and catching them often results in whiplash-like trauma to the spine. Automobile accidents often involve the entire family, although babies often go unchecked because they have no obvious damage or symptoms. Because of the delicate structure of the infant's spine, spinal stretching from trauma is more likely to result in spinal cord trauma with nerve interference than it is in damage to the vertebral segments and soft tissue. One of the top neurologists in the world stated, "Interference to the nervous system results in damage within a short period of time. Therefore, chiropractic care should begin at birth on a preventive basis." Chiropractic is a healthcare system that is founded on the premise that a properly functioning nervous system is essential to overall health and function of the human body. Doctors of chiropractic detect and correct vertebral subluxations by physically adjusting the spine. This restores the nervous system to an optimum level of function, which maximizes the body's inherent healing potential. Chiropractic adjustments restore normal nerve function, improve spinal biomechanics, range of motion, reflex arcs, and posture, all of which are essential to a properly functioning nervous system. Studies that have measured the effect of chiropractic adjustments on the immune system have shown that chiropractic may influence T and B cell lymphocytes, natural killer cell numbers, antibody levels, phagocytic activity, and plasma beta endorphin levels. A study published in the Chiropractic Research Journal compared the health and wellness of 200 children under chiropractic care to 200 children under conventional medical care. The chiropractic group had fewer ear infections, fewer allergies, fewer cases of tonsillitis and asthma. The health of the children under chiropractic care was demonstrably superior to the children who had not received it. Nerve interference associated with birth trauma may result in problems such as breathing weakness, mood irritability, digestive disorders, and difficulty with feeding and attachment, sleeping problems, immunity deficits, and neurological impairment. Chiropractic adjustments for newborns differ significantly from those performed on adults. Often the doctor of chiropractic will use light, fingertip pressure on the baby's spine. Infant adjustments are very gentle, and typically a baby will be soothed by an adjustment or even sleep through the process. It is important to note that 65% of neurological development, in other words, development of the brain and nervous system, occurs in the child's first year of life. It is therefore imperative to ensure that your baby has every opportunity to maximize his or her nerve function during this critical period. Dr. Lennon Smith, one of the top pediatricians in the United States, said every newborn should receive a neck and spine examination and a chiropractic adjustment if necessary. Is that idea too difficult to accept? And finally, Dr. Lee Hadley said subluxation alone is a rational reason for chiropractic care throughout a lifetime from birth. My name is Keith Wasson. I hope you've enjoyed this presentation. If you're a parent with a child, I hope you'll get them checked, their nervous system checked by a doctor of chiropractic in your community.